Hey guys, Ryan and Tiffany here from DeWitt PT talking about how we use the Neubie, but this time in regards to our post-surgical population. So here's the deal. When you get injured or have some sort of trauma, which surgery can be considered a trauma, the way that the brain recognizes that area gets muddled. We say the map gets smudged as far as what the shoulder or the area can do, what muscles are supposed to be online, how it's supposed to function and integrate into the body. So we can use the Neubie post-surgically, first off, just to bring a lot of awareness back into that region. So for her, we've got some pads set up here on her shoulder, and we can just bring some sensitivity to that area. She'll feel something superficially, and that's gonna help reconnect that region into the brain and help to clarify that picture. So we can start doing this really, really early, even with some of our passive range of motion, some of those early exercises we might do in the clinic. Now let's fast forward and say that, hey, let's say she's 10, 12 weeks out, we can get her moving around a whole lot more. We might use the Neubie as she's going through some of her active assisted or even active range of motion exercises. So for Tiffany's example here, I'm gonna turn up this stimulation. Tiffany, go ahead and tell me when it's like why don't you tell me when it's like a 7 out of 10 intensity? Okay, right there? Great. A little lower. Great. As it's bouncing all over the place. All right, so we're just trying to blast her system with some sensitivity. We're not really going for muscle contraction or anything like that. And then Tiffany, I'm just gonna have you go through some really easy active range and just see as you're moving around how it feels. Is that okay?
Yeah.
Cool, so it feels good. You know, again, we're demoing this. She didn't actually have shoulder surgery. But what we're looking for is, again, with all this external stimuli, again, just helping kind of remap the brain and reorganizing where it thinks it is in space and trying to kind of recalibrate that area if you want to think about it that way. Great, so next thing, why don't you give me that stick? Now we're just gonna take it into your active range. Same thing, just go ahead and take both hands, reaching all the way up and overhead for me. So now we're getting a little bit of muscle activation. We'll take her through some functional patterns too. Tiffany, go ahead and go one hand behind your head, one hand behind your back. This is a good one, just to kind of take that shoulder through more ranges of motion. And for most patients, this is totally pain-free, especially with the Neubie on. Great, so then from here, what we can do is we can now change this. So that was just part of it. That was like, hey, I'm gonna wake this area up. Now we wanna turn those muscles on so that they're more effective. So in a particular case, like we're gonna, again, demo that this is a post-surgical shoulder, what we're gonna do is, Tiffany, I'm gonna move these pads. So what I wanna do is I wanna strengthen her rotator cuff. So I'm gonna put one set of pads directly on that posterior cuff that we're trying to get to. So we'll go there and there. And then we also know that we want to stabilize everything around it. So really good shoulder and rotator cuff strength can really only be developed on top of really good core and scapular stability. So what I'm gonna do is I'm gonna put this other set of pads, this other channel effectively, on those muscles between her shoulder blades and try to kick those on, okay? All right, and then I'm gonna change the setting so I can take this down to a training setting. And then Tiffany, you got that band behind you there. Why don't you go ahead? Good. And I'll have you just move out just a little bit so you get some light tension. And then same thing, I'm gonna go ahead and start turning this machine up, the Neubie up. Tell me when it's that same thing, like a 7 out of 10.
That's good.
Right there? Okay, so I'm gonna have you go ahead and take that, externally rotate, pause for a second, and then slowly bring it back in. So now we've switched the use of this machine, just like that. We move the pads around so it specifically is going to target these kind of posterior cuff and posterior shoulder interscap muscles and see if we can make the exercise even more beneficial. We all know some of these basic exercises. Let's see if we can take them, crank up the effectiveness of them by using something like the Neubie. Yeah?
Yep.
All right, feeling good?
Yes.
Okay. So again, it's not just a one-trick pony. We can use this for a whole bunch of reasons. We can move into other functional patterns. We can train whatever positions we think are really important to train and to try to get the right muscles to turn back on, to increase that function, and get people back to where they want to go.